ಮನದ ಮಾತೊಂದ ಬಿಚ್ಚಿಡು ಬಚ್ಚಿಟ್ಟ ಮನದ ಕನಸೊಂದ ಹಿಂದೆ ಸಮಯ ಮುಂದೆ ಇಡಲು ನಮ್ಮ ಹೆಜ್ಜೆಯ ನಿನ್ನ ಸಾಹಸ ರಥಕ್ಕೆ ಸಾರಥಿಯಾಗಿ ಮುನ್ನಡೆಸಿದೆ ನಿನ್ನ ಬಾನಂಗಳ ಕೆಳಗೊಯ್ಯುವ ರೆಕ್ಕೆಯಾಗಿ ಕೂಡಿದೆ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಲಿಸನ್ ಟು ಯೋರ್ ಹಾರ್ಟ್.
ನಮಸ್ಕಾರ. ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಕಾರ್ಯಕ್ರಮದ 420ನೇ ಸಂಚಿಕೆಗೆ ನಿಮಗೆಲ್ಲರಿಗೂ ಸುಸ್ವಾಗತ. ಇಂದು ವಿಜಯದಶಮಿ. ತಮಗೆಲ್ಲರಿಗೂ ದಸರಾ ಹಬ್ಬದ ಶುಭಾಶಯಗಳನ್ನ ಕೋರ್ತಾ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತವನ್ನ ಕೋರ್ತಾ ಇದ್ದೇನೆ. ನಾನು ನಿಮ್ಮ RJ ದೇವದತ್ತ. ನಾನು ನಮ್ಮ ತಂಡದವರಾದಂತಹ ಸುರೇಶ್ ಬಾಬು, ಗೋವರ್ಧನ್ ಗೌಡ, ರವಿ ಪಂಗಾಲ್, ವಿನೋದ್, ತೇಜಸ್, ಲೋಕೇಶ್, ಪೃಥ್ವಿ, ರಮ್ಯಾ, ದಿಲೀಪ್ ಮತ್ತು ಅನು ಇವರೆಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳ್ತಾ ನಿಮ್ಮನ್ನು ಮತ್ತೊಮ್ಮೆ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ವೆಲ್ಕಮ್ ಮಾಡ್ತಾ ಇದ್ದೇನೆ. ನಮ್ಮ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ನಾವು ಪ್ರತಿ ವಾರ ಬೇರೆ ಬೇರೆ ಪ್ರೊಫೆಷನ್ ಇಂದ ಸಾಧಕರನ್ನ ಕರೆದು ಅವರೊಂದಿಗೆ ಸಂವಾದ ಮಾಡ್ತೇವೆ ಮತ್ತು ಅವರ ಸಕ್ಸಸ್ ದಾರಿಯಲ್ಲಿ ಅವ್ರಿಗೆ ಏನೇನು ಹೇಗೆ ಅಚೀವ್ ಮಾಡಿದ್ರು, ಅವರ ದಾರಿಯಲ್ಲಿ ಹೋದಾಗ ಏನೇನು ಕಲ್ಲು ಮುಣ್ಣುಗಳಿಗೆ ಬಂದ್ರು, ಅದನ್ನ ಅವ್ರು ಹೇಗೆ ಓವರ್ಕಮ್ ಮಾಡಿದ್ರು ಅನ್ನೋದು ತಿಳ್ಕೊಳ್ಳೋ ಒಂದು ಸಣ್ಣ ಕುತೂಹಲ ನಮಗೆ. ಯಾಕೆಂದ್ರೆ ಇವರೆಲ್ಲರ ಸಾಧನೆ ನಮಗೆ ಸ್ಫೂರ್ತಿ. ಇಂತಹ ಸಾಧಕರು ನಮ್ಮೊಂದಿಗೆ ಇಂದು ಇರೋದಂದ್ರೆ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಮತ್ತು ಡಾಕ್ಟರ್ ವಿವೇಕ್ ಶಾನ್ಭಾಗ್ ಅವರು. ಇದು ನಮ್ಮ ಹೆಲ್ತ್ ಸೀರೀಸ್, ಅಂದ್ರೆ ನಾವು ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ನಲ್ಲಿ ಹಲವಾರು ಸಂಚಿಕೆಗಳಿಂದ ಹೆಲ್ತ್ ಸೀರೀಸ್ ಅಂತ ಹೆಲ್ತ್ ಮೇಲೆ ಫೋಕಸ್ ಮಾಡಿ ಆದಷ್ಟು ವೈದ್ಯರನ್ನ, ಡಾಕ್ಟರ್ಗಳನ್ನ ಕರೆದು ಅವರೊಂದಿಗೆ ನಾವು ಸಂವಾದ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಅಂಥ ಒಂದು ಸ್ಪೆಷಲ್ ಎಪಿಸೋಡ್ ಇವತ್ತು ಕಂಟಿನ್ಯೂ ಮಾಡ್ತಾ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಮತ್ತು ಡಾಕ್ಟರ್ ವಿವೇಕ್ ಶಾನ್ಭಾಗ್ ಅವರು ನಮ್ಮೊಂದಿಗೆ ಇದ್ದಾರೆ. ಇದರಲ್ಲಿ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಅವರು 26 ವರ್ಷಗಳಿಂದ ಶಿ ಇಸ್ ಅ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊಫೆಷನಲ್. ಅವರ ಮೆಡಿಕಲ್ ಪ್ರೊಫೆಷನ್ ಜೊತೆ ಈಗ ಸ್ಟಾರ್ಟ್ಅಪ್ ಕೂಡ ಮಾಡಿ ಪ್ಲೆಡ್ಸ್ ಅಂತ ಸ್ಟಾರ್ಟ್ಅಪ್ ನ ಶುರು ಮಾಡಿದ್ರಲ್ಲಿ ಅವರು ಆನ್ಲೈನ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಪ್ರೋಗ್ರಾಮ್ಸ್ ನ ಆಫರ್ ಮಾಡ್ತಾರೆ. ಮತ್ತೆ ಅವರು ಸೌತ್ ಏಷ್ಯಾಸ್ ಫಸ್ಟ್ ಮೈಕ್ರೋಬಯೋಮ್ ಕಂಪನಿ ಅಂದ್ರೆ Bugspeaks ಅಂತ ಒಂದು ಕಂಪನಿಯಲ್ಲಿ ಅವರು ಇನ್ವಾಲ್ವ್ ಕೂಡ ಆಗಿದ್ದಾರೆ. ಅವರು ಶಿ ಅಡ್ವೊಕೇಟ್ಸ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಮೆಡಿಸಿನ್ ಅಂಡ್ ಹ್ಯಾಸ್ won mBillionth award from World Summit Awards. Now she focuses specifically on gut health. It's a very important topic. ನಾವು ಅದ್ರ ಬಗ್ಗೆ ಮಾತಾಡೋಣ. ಅವರೊಂದಿಗೆ ನಮ್ಗೆ ಇನ್ನೊಬ್ರು ಡಾಕ್ಟರ್ ಕೂಡ ಇದ್ದಾರೆ ನಮ್ಮ ಜೊತೆ, ಡಾಕ್ಟರ್ ವಿವೇಕ್ ಶಾನ್ಭಾಗ್ ಅವರು ಈಸ್ ಅ ಲೈಸೆನ್ಸ್ಡ್ ನ್ಯಾಚುರೋಪಥಿಕ್ ಡಾಕ್ಟರ್ ಹಾಗೂ ಆಯುರ್ವೇದ MD ಕೂಡ. ಈಸ್ ದ ಫೌಂಡಿಂಗ್ ಡೀನ್ ಆಫ್ ಸ್ಕೂಲ್ ಆಫ್ ಆಯುರ್ವೇದ ಅಂಡ್ ನ್ಯಾಚುರಲ್ ಮೆಡಿಸಿನ್ ಅಟ್ ದಿ ಯೂನಿವರ್ಸಿಟಿ ಆಫ್ ಸಿಲಿಕಾನ್ ಆಂಧ್ರ, ಹಾಗೂ ಮತ್ತು ನ್ಯಾಚುರಲ್ ಮೆಡಿಸಿನ್ ಅಂಡ್ ಆಯುರ್ವೇದ ಕ್ಲಿನಿಕ್ ಪಂಚಕರ್ಮ ಸೆಂಟರ್ ಇನ್ ಸ್ಯಾನ್ ಹೋಸೆ, where they're specializing in holistic living and health. ಇವರಿಬ್ರು ನಮ್ಮ ಜೊತೆ ಇರೋದು ನಮ್ಮ ಪುಣ್ಯ. ನಿಮ್ಮಿಬ್ಬರಿಗೂ ವೆಲ್ಕಮ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ವೆಲ್ಕಮ್ ಟು ದ ಶೋ.
ನಮಸ್ಕಾರ.
Thank you so much.
So I did a brief intro, but ನಿಮ್ಮಿಂದ I just want to ನಮ್ಮ ಶ್ರೋತೃಗಳಿಗೆ ನಿಮ್ಮ ಬಾಯಿಂದನೇ ಒಂದು ಕ್ವಿಕ್ ಇಂಟ್ರೋ ಕೇಳಕ್ ಆಸೆ. ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಅವರೇ, ದಯವಿಟ್ಟು ತಾವು ವಾಟ್ ಈಸ್ ಯುವರ್ ಸ್ಪೆಷಲೈಸೇಷನ್, ವಾಟ್ ಈಸ್ ಯುವರ್ ಫೋಕಸ್, ಅದ್ರ ಬಗ್ಗೆ ಒಂದು ಕ್ವಿಕ್ ಇಂಟ್ರೋ ಕೊಟ್ರೆ ನಮ್ಗೆ ಅನುಕೂಲ ಆಗುತ್ತೆ.
Sure. ಎಲ್ಲರಿಗೂ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ವಿಜಯದಶಮಿಯ ಶುಭಾಶಯಗಳು. And I also want to thank Bengaluru Voice ಅವರಿಗೆ ನನಗೆ ಈ ಅಪಾರ್ಚುನಿಟಿ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ. So I am a physician by education. ನಾನು ಮೆಡಿಸಿನ್ ಇಂಡಿಯಾದಲ್ಲಿ ಮಾಡಿದ್ದು ಅಂಡ್ ಅಲ್ಲೇ ಸುಮಾರು 22 ವರ್ಷ ಅಲ್ಲಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾ ಇದ್ದೆ ನಾನು. ಅಂಡ್ ಜನರಲ್ ಮೆಡಿಸಿನ್ ನಂದು ಕ್ಲಿನಿಕ್ ಇತ್ತು. ಅಂಡ್ then in 2015-16 ಅಲ್ಲಿ I had a startup wherein ನಾನು health education field ಅಲ್ಲಿ mainly to do with maternal health and space alidu startup, and I was recognized with the mBillionth award and all that. And after that COVID time ali on salpa I was very interested in lifestyle medicine. Can instead of just giving out, being a machine giving out medicines ellarigu kododu badlige, especially chronic diseases, acute diseases obviously we need medicines, and surgery ella. But chronic diseases, is there a way out? Now lifestyle changes ಇಂದ ಏನಾದ್ರೂ ನಾವು ಹೆಲ್ಪ್ ಮಾಡ್ಬೋದಾ ಅಂತ ನನ್ಗದೊಂದು ಐ ವಾಸ್ ವೆರಿ ಇಂಟ್ರೆಸ್ಟೆಡ್. ಸೊ ಅದು ಐ ಸ್ಟಾರ್ಟೆಡ್ reading more about it, did a lot of research, and then I went into a lifestyle medicine field, and that gave birth to Pledze Nandu company. I started that along with another uh, friend and my uh, classmate from school. So we both started Pledze Center, which is into lifestyle medicine. And I'm also involved with, as you said, Bugspeaks, and that's big into gut health. And yeah, we'll be talking more about gut health too, I guess. So yeah, that's a brief introduction. And it's been 1.5 years since I moved to US ಮತ್ತು ಈಗ US ಅಲ್ಲಿದ್ದೇವೆ. So I'm so glad to be back here. Thank you.
ಥ್ಯಾಂಕ್ ಯು. ವೆಲ್ಕಮ್ ಟು ದ ಶೋ. ಮತ್ತೆ ಇನ್ನೊಂದು ರಹಸ್ಯ ಏನಪ್ಪಾ ಅಂದ್ರೆ, ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಅವರು ನಮ್ಮ ರವಿ ಪಂಗಾಲ್ ಅವರ ಸಿಸ್ಟರ್. ಸೊ ಅವರು ಬಂದಿರೋದು ನಮಗೆ ಡಬಲ್ ಸಂತೋಷ ಇಲ್ಲಿ.
Yeah.
ಸೊ ಡಾಕ್ಟರ್ ಶಾನ್ಭಾಗ್ ಅವರೇ, ಹೌ ಅಬೌಟ್ ಯು? ತಾವು ದಯವಿಟ್ಟು ಒಂದು ಕ್ವಿಕ್ ಇಂಟ್ರೋ ಕೊಟ್ರೆ.
ಶ್ಯೂರ್. ತುಂಬಾ ಥ್ಯಾಂಕ್ಸ್ ದೇವ್ ಅವರೇ ಅಂಡ್ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಅವರಿಗೆ ಧನ್ಯವಾದ ನಮಗೆ ಈ ಅಪರ್ಚುನಿಟಿ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ. ಸೊ ನಾನು ಕರ್ನಾಟಕ ಯೂನಿವರ್ಸಿಟಿ ಧಾರವಾಡ ಅಲ್ಲಿ ಆಯುರ್ವೇದ 5.5 years ಗ್ರಾಜುಯೇಷನ್ ಮಾಡಿ, ಆಮೇಲೆ ಪೂನಾ ಯೂನಿವರ್ಸಿಟಿಲಿ ನಾನು MD ಮಾಡಿದ್ದು. Then I practiced in Pune for 3 years and was heading a research institute there. So I came here to US in 1989. So for last 35 years, I have been practicing here. First in Seattle. ನೀವು ಹೇಳಿದ್ದು ನಮಗೆ ಏನು hurdles ಬಂದು. So when I first came here, my total 9 years of Ayurveda education in 2 different universities in India was of no legal value here. So I went back to university in Washington State, Seattle, and did my doctorate in naturopathic medicine, took board exams, okay, and then became a licensed primary care provider. So in Seattle, we had a clinic, and then for last 13 years, we have clinic here in San Jose now, near Santana Row. And we work as primary care providers. So patients come to our clinic anywhere from cold to cancer and from pain to Parkinson. And we have a whole team of 7 experts in Ayurvedic medicine, naturopathic medicine, nutrition, physical therapy, and we do all of the traditional Ayurvedic treatments for all chronic health problems, like whether it is diabetes, heart disease, obesity, skin diseases, musculoskeletal, various types of pains, digestive disorders, women's hormonal problems, sleep, and uh, uh, neurological disorders. So all chronic diseases, Padma ಅವರು ಹೇಳಿದಾಗೆ, for acute emergencies and various accidents, or where there is urgent needed, we have to use the conventional medicine. But when it comes to chronic health problems where your metabolism is completely compromised and you have to make fundamental changes in your lifestyle and diet, Ayurvedic medicine, and also the clinically proven Ayurvedic herbal formulas and all of the treatment procedures are very helpful. And so we have been primary care providers to almost 15,000 families here in Bay Area. And most specialists do refer all chronic cases to us. So gastroenterologist, gynecologist, rheumatologist, asthma specialist, they refer patients to our clinic. And so we have a whole team here with the 3,000 square feet state-of-the-art facility near Santana Row.
ವಾವ್, ವೆರಿ ಇಂಪ್ರೆಸಿವ್. ಆಕ್ಚುಲಿ ಇದು ನಮ್ಮ ಹೆಲ್ತ್ ಸೀರೀಸ್ ಆದ್ರಿಂದ ನಮ್ಮ ಇಲ್ಲಿ US ಆಡಿಯನ್ಸ್ ಎಲ್ಲ ಇಟ್ಸ್ ಎ ವೆರಿ ಯೂಸ್ಫುಲ್ ಇನ್ಫಾರ್ಮೇಶನ್. ಸೊ I'll ask one follow-up question, ಮತ್ತೆ we'll discuss a little bit more later. So you said you're a PCP. So I think you already said that, like, if it's a disease that has to be treated not as non-chronic, so you do normal prescription medicine. Illandre it comes to Ayurvedic medicine. Is that what I heard?
Yeah, so as PCP, since our focus is on Ayurveda and naturopathic medicine. I have a license to do prescription for the medicines, but I don't prescribe any of the regular medicines. I focus on my passion and my specialty, which is Ayurveda and naturopathic medicine. And I believe that Ayurveda and naturopathic medicine can treat all health problems. ನಿಮ್ಗೆ ಹೇಳಿದಾಗ I have raised a son, Omkar, and for him, for all of his health problems, we have used only Ayurveda and natural medicine, except okay, when he had some injury and any accident. In those cases, we have used emergency conventional medicine.
Wow, very impressive. So, ಇವತ್ತು ನಮ್ಮ ಫೋಕಸ್ ಅಂದರೆ ನಾವು ವಿ ವಾಂಟ್ ಫೋಕಸ್ ಆನ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಂದರೆ ಹೌ ಟು ಮ್ಯಾನೇಜ್ ಅವರ್ ಹೆಲ್ತ್ ಥ್ರೂ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್. ಅಂದರೆ ಲೈಕ್ ಮೆಡಿಸಿನ್ಸ್ ಆರ್ ಆಲ್ವೇಸ್ ಲೈಕ್ ವಿ ಟ್ರೀಟ್ ಸಿಂಪ್ಟಮ್ಸ್ ಅಲ್ವಾ, ವಿ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಟ್ರೀಟ್ ಸಿಂಪ್ಟಮ್ಸ್, ವಿ ವಾಂಟ್ ಟು ಸಿ ಹೌ ಟು change our lifestyle to live a better life. And that could be one of our main goals of our health series, to help people get better with their health. So Hagagi, I have a few questions, which are some of the top of the mind questions for us. And I'll just go, Dr. Padma Rammoorthy shuru martini, and then Dr. Vivek, I'll come to you. So Padma, I just wanted to ask you, what is, can you tell us a little bit about our gut? We hear that a lot. Or these days, gut health, gut microbiome is very important ಅಂತ ಎಲ್ಲ ಕಡೆ ಕೇಳ್ತಾ ಇರ್ತೀವಿ. ಆದ್ರೆ ಏನು ನಮ್ಮ ಗಟ್ ಅಂದ್ರೆ, can you please tell us a little bit about it?
Sure. Yeah. So as you rightly said, Vika, I mean, if you have not heard about gut health and gut microbiome, it's there all over, and everybody is going, ellaru kombucha, kimchi, ella togoludralliddare, because everybody, I mean, people have realized that you need to. So what is there in this kombucha or kimchi that is so important, that's so healthy for our gut and helkondu now when we think about it? Basically, ಏನಂದ್ರೆ ನಮ್ದು if you have to guess, like namdo human cells are maybe 10 trillion in number, but can you guess the number of microbes that are there in our body? It's
10 times that?
3 times that. 3
Okay.
times, almost 30. Again, it's a big number, 30 to 40 trillion and ಹೇಳ್ತಾರೆ. So many, it's like we are more microbes, we are more bacteria, viruses than ourselves. In fact, even genetically, when we see, we have 24,000 genes ಅಂತಿದೆ ನಮ್ಮಲ್ಲಿ, but the genes, microbial genome ನೋಡಿದ್ರೆ they are 2 to 3 trillion in a million in number. So that's the number of 100 times more genetically also namdo microbes determine us. So when I mean, all this we can always think, how come nam ಮೊದಲೆಲ್ಲ ಗೊತ್ತಿರಲಿಲ್ಲ ಅಂತ ಹೇಳ್ಕೊಂಡು, because these main ಏನಂದ್ರೆ ಈ microbes ಎಲ್ಲ which are sitting in our gut, they are anaerobic. So oxygen illada idರಲ್ಲಿ they can develop very well and they exist there. ಹೊರಗೆ ಬಂದ ಕೂಡಲೇ ಆಕ್ಸಿಜನ್ ಇದ್ದಲ್ಲಿ they cannot exist. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ಇಟ್ ವಾಸ್ ಡಿಫಿಕಲ್ಟ್ ಟು, ಸ್ವಲ್ಪ ಸ್ಟೂಲ್ ಕಲ್ಚರ್ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ರು, ಬಟ್ ಈ ಅನರೋಬಿಕ್ ಆರ್ಗ್ಯಾನಿಸಮ್ಸ್ ಅನ್ನ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗ್ತಾ ಇರಲಿಲ್ಲ. ಬಟ್ 2005 ಅಲ್ಲಿ ಹಾಗೆ ನೆಕ್ಸ್ಟ್ ಜನರೇಷನ್ ಸೀಕ್ವೆನ್ಸಿಂಗ್ ಅಂತ ಹೇಳ್ಕೊಂಡು DNA ಸೀಕ್ವೆನ್ಸಿಂಗ್ ಎಲ್ಲ ದಟ್ ಟೆಕ್ನಾಲಜಿ ಡೆವಲಪ್ ಆದ ಕೂಡಲೇ now we were able to isolate these microbes. I mean, we could figure out ಯಾವ್ದು ಏನಿ microbes exactly ಅಂತ ಹೇಳಿ. So then they could human genome project ಅಂತ NHS ಅವರು ಫಂಡ್ ಮಾಡಿದ್ದು, and ಅದರಿಂದಾಗಿ they were able to determine ಏನೆಲ್ಲ ಈ microbes ಇದೆ ಈ ಗಟ್ಟಲ್ಲಿ, ಎಷ್ಟು microbes ಇದೆ, and they were able to name them. So there is a database now of all these microbes. They almost 5,000 species they were able to identify, which is in our gut and airborne. Again, not all 5,000 species are sitting. Everybody, like a fingerprint tara, everybody's microbiome is different. And it depends on so many factors. When you really look at it, now mogu vaginal birth in the C-section anta, even that can determine what kind of microorganisms are there in our gut. Because vaginal birth agwaga, that's the first time moguge it gets the first sample of the microbes from the mother's vagina. And C-section ಆದದಲ್ಲಿ unfortunately ಆ ಮಕ್ಕಳಿಗೆ that first culture ಇರಲ್ಲ, that first seed of microbes ಇರಲ್ಲ. But then breast milk ಅಲ್ಲಿ there is human oligosaccharides anta. So microbes are there which digest the breast milk, the oligosaccharides ಇರೋದು breast milk ಅಲ್ಲಿ, and that helps in developing our immunity. So ಇದೆಲ್ಲ ಇದ್ದ ಕಾರಣ these microbes are like they are in a symbiotic relationship ನಮ್ಮ intestine ಅಲ್ಲಿ. ಅಂದ್ರೆ ಅವರುಗಳು it's like a give and take kind of a relationship. ಅವುಗಳು ನಮ್ಮ intestine ಅಲ್ಲಿ ಇದ್ದಾವೆ, we are renting out the space to them. In turn ಅವ್ರುಗಳೇನ ಮಾಡಬೇಕು. So they are actually doing a lot of things in terms of immunity ನಮಗೆ, in terms of regulation, glucose regulation. In fact, there is a gut and brain connection ಅಂತ ನೋಡ್ತಾರೆ. 80% of the serotonin is produced in the gut. So many ways it is actually helping us in keeping us healthy. It's acting like a barrier, ella attackta ide. So this is how important our gut health is, and by eating these, like for example this probiotics ella, we are cultivating a good microbial population namma gut alli.
Yeah, so I was going to ask you
yeah.
about that. So, like, it obviously seems like from a modern medical perspective, it's very important to maintain a good gut health. alwa? So, what lifestyle changes do you recommend for improving our gut health? And also, maybe we should start by figuring out how do we establish how good our gut health is.
Exactly. Yeah. So as I said, because of the new technology now, the sequencing technology, DNA sequencing technology, the karana, you can do something called a gut microbiome testing, stool testing and there. So our stool testing ಮಾಡಿದಾಗ what we do is first of all extract the stool sample ಇಂದ DNA extract ಮಾಡ್ತಾರೆ. DNA ಮಾಡಿ ಮತ್ತೆ ಅದರಲ್ಲಿ ಏನೇನ್ ಮೈಕ್ರೋಬ್ಸ್ ಇದೆ ಅಂತ ಹೇಳ್ಕೊಂಡು with another database, reference database ಇಂದ they will you can make out what are the microorganisms which are there in your gut.
So, is
what
that
are
like,
the
can anybody get that test, or like, do we need a PCP to prescribe it?
anybody can get it, but I mean it's not obviously covered by the insurance as of now, so you'll have to pay it out of pocket and get it done. But the thing is the report is a little it's very comprehensive, the reporting. So ಅದೇನೇನಿದೆ ಅಂತ ಅವ್ರ ರಿಪೋರ್ಟ್ ಅಲ್ಲಿ ಗೊತ್ತಾಗುತ್ತೆ, ಬ್ಯಾಕ್ಟೀರಿಯಾ ಏನೇನಿದೆ ಅಂತ. ಬಟ್ ವಾಟ್ ಆರ್ ದೇ ಡೂಯಿಂಗ್ ಇನ್ ಆರ್ ಗಟ್? ಆರ್ ದೇ ಹೆಲ್ಪಿಂಗ್ ಅಸ್? ಆರ್ ದೇ ದ ಬ್ಯಾಡ್ ಗೈಸ್ ದೇರ್? ಹೇಗೆಲ್ಲ ಗೊತ್ತಾಗುತ್ತೋ ಯು it will be a little confusing for a normal lay person to understand the reporting fully. So you may need to approach a functional medicine doctor, or the company which does it also sits down and explains it about the reporting. And usually, so based on those microbes, there is also a recommendation of what kind of probiotics to be taken, what kind of prebiotics. So again, for these microorganisms to be happy and healthy and make us healthy, they need to be fed the right kind of food.
Okay.
So that's where, as you asked me, the lifestyle really matters. Processed food, like, you know, when there was an experiment wherein they compared the stool sample of the Hadza gatherer in, you know, the hunter gatherer in the Africa, the Hadza tribe, and the American or the Western ಮಕ್ಕಳದ್ದು stool sample, ಅಲ್ಲಿನ stool sample compare ಮಾಡಿದಾಗ, ಸೊ ದ ಅಗೇನ್ ಡೈವರ್ಸಿಟಿ ಅಂತ ಹೇಳ್ತಾರೆ, ಅಂದ್ರೆ ಎಷ್ಟು ಮೈಕ್ರೋಬ್ಸ್ ಇದೆ, ಹೆಚ್ಚು ವೆರೈಟಿ ಇರೋದು, that's more important because every microbe is doing one function in your body. So ಎಲ್ಲರಿದ್ರೆ ಒಟ್ಟಿಗೆ ಒಂಥರ ಒಂದು ಕಂಪನಿ ತರ, ಯು ಶುಡ್ ಹ್ಯಾವ್ ಆಲ್ ಸ್ಕಿಲ್ ಸೆಟ್ಸ್ ಇರೋರು ಇರ್ಬೇಕಲ್ವಾ ಕಂಪನಿಲಿ ಫಾರ್ ಇಟ್ ಟು ರಿಯಲಿ ಇವಾಲ್ವ್. ಅದೇ ತರ ಯು ನೀಡ್ ಟು ಹ್ಯಾವ್ ಡಿಫ್ರೆಂಟ್ ಕೈಂಡ್ ಆಫ್ ಮೈಕ್ರೋಬ್ಸ್, ಡೈವರ್ಸ್ ಮೈಕ್ರೋಬ್ಸ್, ಫಾರ್ ಇಟ್ ಟು ಬಿ ಅ ವೆರಿ happy and nurturing environment. So when you compare the tribe, the hunter-gatherer tribe, ಇದು stool sample and ಇಲ್ಲಿದ್ದು, the diversity is like 3 to 4 times more in the stool sample of the African ಇದು, ಬಿಕಾಸ್ ಅವರುಗಳೆಲ್ಲ ಏನು ಜಾಸ್ತಿ ಫೈಬರ್ ತಿಂತಾರೆ, ತುಂಬಾ ಕಮ್ಮಿ ಪ್ರಾಸೆಸ್ ಫುಡ್ ತಿಂತಾರೆ, ದೇ ಆರ್ ವೆರಿ ಆಕ್ಟಿವ್, I would say less stressed. So all these make their gut microbiome more healthy versus illiddu they have very minimal species. Most of the species have been killed off because of the bad diet or the bad lifestyle. So yeah, that's the main thing.
Yeah, no, definitely. I think like low stress, good diet, and
Yeah.
what was the third one? High fiber. It's
Yeah,
early.
high fiber, very good diet. So, which is high fiber, because that fiber is the prebiotic which is feeding the microbiome. So,
Yeah.
yeah,
So
that's the mantra.
that was very insightful. So Dr. Shanbhag ಅವರೇ, how does Ayurveda view the importance of gut health? ಅಂದ್ರೆ ಇದರಲ್ಲಿ ನಮ್ಮ ಇಂಡಿಯನ್ ಡಯಟ್ಸ್ ಮತ್ತೆ ಇಂಡಿಯನ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಲ್ಲಿ ಸಾವಿರಾರು ವರ್ಷದಿಂದ ಇರುವಂತಹ ಇತಿಹಾಸ ಇದೆಯಲ್ಲ. ಸೊ ಲೈಕ್ ಹೌ ಡು ಯು ಗೈಸ್ ವ್ಯೂ ದ ಇಂಪಾರ್ಟೆನ್ಸ್ ಆಫ್ ಗಟ್ ಹೆಲ್ತ್ ಅಂಡ್ ಹೌ ಕ್ಯಾನ್ ವಿ ಇಂಪ್ರೂವ್ ಇಟ್?
Gut health is very important. ಮುಂಚೆ ಎಲ್ಲರೂ ಹೇಳ್ತಿದ್ರು ಯು ಆರ್ ವಾಟ್ ಯು ಈಟ್ ಅಂತೇಳಿ. Now the more wise part to say is you are not only what you eat, but you are also what you digest. So because eating and not digesting doesn't help. And what your body does is that when you are not digesting, it gives you a whole range of symptoms. For example, there can be burping, there can be acid reflux, there can be heartburn, there will be bloating, there will be flatulence, then there can be constipation or not well formed stools, there can be diarrhea, there can be abdominal pain. So all of those symptoms are a clear telltale, are a clear signal that our body gives. Also, there can be coating on the tongue, there can be bad breath. So, all of those are classic symptoms of gut health going out of balance. So, ಅದಕ್ಕೆ ಆಯುರ್ವೇದದಲ್ಲಿ ಜಾಠರಾಗ್ನಿ or ಪಾಚಕಾಗ್ನಿ ಅಂತ ಹೆಸರಿದೆ. So, to correct that whole gut health, there are first of all, that detailed history taking is very important in Ayurveda. So you not only take a look at tests, but you also look at what clear signals the body is giving in terms of these various digestive symptoms. So the detailed history is important. And then after that, actually examining the digestive system, because that is there any pain in the liver area? Is there any extension of the belly area where the person feels discomfort? Does the person not feel satisfied after a meal? Do they feel low energy and sleepy or drowsy after certain feeds? So you take the history, you do the physical exam, you examine the tongue, and then based on that, you are able to make assessment what is going on. Amala, to correct that, of course, diet is very important. So variety of vegetables. So it is not only vegetables, but a variety of vegetables is important. Unfortunately, uh, munche, if you are in say Nebraska or if you are in say Wisconsin somewhere, you would get maybe only 15 different types of vegetables. But luckily now here in Bay Area, with all of the imported vegetables and with all of the various nationalities, we have variety of vegetables available. So we advise our patients to include maximum variety of vegetables and variety of fruits, because that's where Padma ಅವ್ರು ಹೇಳಿದಾಗ you get the variety of the whole microbiome in your digestive system.
So should the
Another thing is
vegetables and fruits be, I mean, sorry, not, of course not the fruits, but should the vegetables be cooked or should be eaten raw? If you want to maintain a microbiome, does it
no,
have to?
you should not be eating. So the leaves can be eaten as raw once they are cleaned, but steaming or cooking vegetables does not completely kill them. In fact,
Okay.
it provides the right enzymes, okay, and the right fibers, okay, for the gut bacteria to grow. Another important thing is having the proper balance of the microbiome through foods. For example, fermented foods. Now, idli dosa ಮಾಡ್ತೀವಲ್ಲ, so that's where okay, you also get the proper gut helping bacteria. Another is majjige, mosuru. So
Mhm.
so there is actually a subhashita in Ayurveda is chakram takram durlabha, means that Indra is so unfortunate that in heaven he does not get buttermilk. So he doesn't get the actual get bacteria. So the
Wow.
Indra is considered as unfortunate when it comes to his gut health, because there are no microbiomes in the heaven. So there is so much of importance of buttermilk and yogurt in diet. So that's why traditionally nam kade at the end of the meal, okay, we have the musaranna, because it
Correct.
actually reestablishes, okay, your gut health. Same way, homemade uppinkai, uh,
Mhm.
those pickles have the right amount of the healthy bacteria grown in them. So whether it is fermented foods like idli, dosa, or uh, pickles, and then having a good balance of homemade buttermilk or yogurt, that's important. Then giving the right gap in between meals is important. For example, not grazing throughout the day, and then having uh, proper gap in between your breakfast, lunch, and dinner, that allows the gut to digest things, okay, and then also for the microbes to have a healthy balance. One damage happens when people get repeated dosages of antibiotics, because
Mhm.
antibiotics is like carpet bombing. They want to kill the harmful bacteria, but they do not spare the healthy bacteria. So it just goes and kills all healthy as well as unhealthy bacteria. So then you have to, specifically after antibiotic courses, when people take them for 10 days, or they take repeated antibiotics, whether it is because of respiratory problems or because of, say, urinary tract infection or any other skin infection, and people take repeated courses of antibiotics, that really messes the gut health. So after that, you need to take efforts to replant them by including the proper diet. So and the quality of water is very important. So if you have um, uh, um, good quality water that you are including on a daily basis. Another thing that Ayurveda helps to balance the gut microbes or gut health is right use of culinary herbs, or what we call as spices. So
Mhm.
spices are not just used for only flavor and for bringing color. They provide you the necessary enzymes and also the microbes. So, for example, the whole umbelliferae family, andre um, fennel, cumin, andre sopu, jirge, then ajwain, also using coriander, methi, turmeric. All of these give you the right balance of digestion. So, using proper culinary herbs or spices in the right amount based on what your metabolism is, that helps the gut health.
Awesome.
Finally,
Mhm.
the most important part is to avoid processed foods. Again, processed foods have killed all of the healthy microbes, and specifically processed white sugar is the biggest poison. So,
Mhm.
white sugar, it allows unhealthy bacteria to multiply in a big speed, and then you start getting many of these symptoms like burping, acid reflux, bloating, flatulence, constipation, diarrhea, um, uh, bad breath, coating on the tongue. And as soon as you have those symptoms, you should get them addressed and reverse it.
Got it. Actually, it's a good segue for our next part of the conversation. And then you brought up white sugar. So I wanted to talk about diabetes and then how to control it. But before that, we'll take a quick break. Break na ನಂತರ ನಮ್ಮ ಸಂವಾದ ಮುಂದುವರ್ಸೋಣ.
Tax, the leading tax consultant in the Bay Area. Prasanna Kumar ಅವರು ಯಾರಿಗೆ ತಾನೇ ಗೊತ್ತಿಲ್ಲ, ಬೇ ಏರಿಯಾದ ಪ್ರೊಫೆಷನಲ್ ಟ್ಯಾಕ್ಸ್ ಕನ್ಸಲ್ಟೆಂಟ್. Tax filing, tax preparation, accounting, planning, bookkeeping services for individual ಅಥವಾ small business. ಯಾವುದೇ ಥರದ ಟ್ಯಾಕ್ಸ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಪ್ರಶ್ನೆಗೆ you can reach Prasanna Kumar at 408-222-0259. Mysuru Sriranga for all your automobile services. 20 ವರ್ಷಗಳಿಂದಲೂ ಬೇರೆಯಲ್ಲಿ ಅತ್ಯುತ್ತಮ ಸರ್ವಿಸಸ್ನ ಕೊಡ್ತಿದ್ದಾರೆ. ನಿಮ್ಮ ವಾಹನದ ಆರೈಕೆಗೆ ಒನ್ ಆ್ಯಂಡ್ ಓನ್ಲಿ ಪರ್ಸನ್ ಶ್ರೀ ಆಟೋ ಸರ್ವಿಸಸ್. ಶ್ರೀ ಆಟೋ ಸರ್ವಿಸಸ್ ಫ್ರೀಮಾಂಟ್ನಲ್ಲಿದೆ. ಅವರ ಫೋನ್ ನಂಬರ್ 5109968404. ಇನ್ನೊಮ್ಮೆ 5109968404. ಅಮೇರಿಕಾದಲ್ಲಿ ಮನೆ ತಗೊಳ್ಬೇಕು ಅನ್ನೋದು ನಿಮ್ಮೆಲ್ಲರ ಡ್ರೀಮ್ ಅಲ್ವಾ? ಈ ಡ್ರೀಮ್ನ ಸಹಕಾರ ಮಾಡಕ್ಕೆ ಬಂದಿದ್ದಾರೆ ನಮ್ಮ ಗಿರೀಶ್ ಬ್ಯಾಂಗ್ಳೂರ್. ಎಸ್, ರಿಯಲ್ ಎಸ್ಟೇಟಲ್ಲಿ ಟಾಪ್ ನಾಚ್ ಸರ್ವಿಸ್ ಕೊಡ್ತಿರೋ ಗಿರೀಶ್ ಅವರು ನಮ್ಮ ಕನ್ನಡಿಗರೇ. ಕನ್ನಡದವರೇ ಆದ ಗಿರೀಶ್ ಜೊತೆ ರಿಯಲ್ ಎಸ್ಟೇಟ್ ಬಗ್ಗೆ ತಿಳ್ಕೊಳ್ಳೋಕ್ಕೆ ಬಹಳ ಚೆನ್ನಾಗಿರುತ್ತೆ. ಹೀ ಈಸ್ ಸೋ ನಾಲೆಜಬಲ್. ನನ್ನ ಪರ್ಸ್ನಲ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್, ರಿಯಲ್ ಎಸ್ಟೇಟ್ ಇನ್ ಆ್ಯಂಡ್ ಔಟ್ ಚೆನ್ನಾಗಿ ತಿಳ್ಕೊಂಡಿದ್ದಾರೆ. ಎಲ್ಲಿ ನಿಮ್ಮ ಡ್ರೀಮ್ ಹೌಸ್ ತೊಗೋಬೋದು, ಎಲ್ಲಿ ಇನ್ವೆಸ್ಟ್ ಮಾಡ್ಬೋದು, ಬೀಚ್ ಯೋರ್ ಫಸ್ಟ್ ಹೋಮ್ ಆರ್ ಯೋರ್ ಸೆಕೆಂಡ್ ಆರ್ ಮೆನಿ ಮೋರ್. ಫಾರ್ ರೀಚ್ ಔಟ್ ಗಿರೀಶ್ ಆಟ್ 408-420-0646 ಅಥವಾ gbangalore@interroad.com. ಫೈನಾನ್ಷಿಯಲ್ ಫ್ರೀಡಮ್ ಯಾರಿಗೆ ತಾನೇ ಬೇಕಿಲ್ಲ? ಬಟ್ ಫೈನಾನ್ಷಿಯಲ್ಸ್ ಅಂದ ತಕ್ಷಣ ತಲೆನೋವು ಜಾಸ್ತಿ ಅಲ್ವಾ? ಡೋಂಟ್ ವರಿ, ಫಾರ್ ಆಲ್ ಯುವರ್ ಫೈನಾನ್ಷಿಯಲ್ ಕ್ವೆಶ್ಚನ್ಸ್, ಎಸ್, ಇನ್ವೆಸ್ಟ್ಮೆಂಟ್ ಇರ್ಬೋದು, 401k ರೋಲ್ ಓವರ್ ಇರ್ಬೋದು, ರಿಟೈರ್ಮೆಂಟ್ ಪ್ಲಾನ್ಸ್, ಡೆಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್, ಎಜುಕೇಷನಲ್ ಸೇವಿಂಗ್ಸ್, ಫಿನಾನ್ಷಿಯಲ್ ಪ್ಲಾನಿಂಗ್, ಪ್ರೊಟೆಕ್ಷನ್, ಲೈಫ್, ಆಟೋ, ಹೋಮ್, ರೀಫೈನಾನ್ಸ್ ಆರ್ ಮಾರ್ಗೇಜ್ ಲೋನ್ಸ್ ಯಾವುದೇ ಇರ್ಬೋದು. ನಿಮ್ಮ ಎಲ್ಲ ಲೀಗಲ್ ಸಮಸ್ಯೆಗೆ ಪರಿಹಾರ ಬೇಕು ಅಂದರೆ ಎಸ್, ರೀಚ್ ಔಟ್ ಟು ಅನಿಲ್ ಹಾಲಪ್ಪ. ಹೌದು, ಅನಿಲ್ ಹಾಲಪ್ಪ ಅವರ ಮೊಬೈಲ್ ನಂಬರ್ 209-380-9858 ಅಥವಾ halappa@primerica.com. ನಮ್ಮ ಎಲ್ಲ ಸ್ಪಾನ್ಸರ್ಸ್ಗಳಿಗೂ ನಮ್ಮ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಕಡೆಯಿಂದ ಒಂದು ಬಿಗ್ ಥ್ಯಾಂಕ್ ಯು.
Welcome back. Dr. Shanbhag, I wanted to bring up the topic of diabetes next. I was just checking some stats. It looks like nearly 10% or close to 11% of the US population, like nearly 40 million people have some sort of diabetes, either type 2 or type 1. And I'm pretty sure in your practice, you get a lot of diabetes patients as well. So Ayurvedalli, how can we manage diabetes? And also, ನಿಮ್ಮ ಹತ್ರ ಮುಂಚೆ ಮಾತಾಡ್ತಾ ಇದ್ದಾಗ you were talking about a morning routine. ಹೇಗೆ ನಾವು we can start off our morning routine and make our day good and our week and month good ಅಂತ ನೀವು ಹೇಳಿದ್ರಿ. How do you tie all of that back to a lifestyle change and management of diabetes?
Thank you for asking that question. Diabetes is not a disease that suddenly attacks you. It is a very slow process, but it's a dangerous process. It's a silent killer. And it happens because of our current modern city diet and lifestyle. Our ancestors used to have a lot of activity throughout the day for their day-to-day survival. We unfortunately sit for our work. Most of us do desk jobs. Then we sit for driving. Then for relaxing, we again sit with our cell phones or with the television or whatever else we are doing. So that lack of activity is one big problem. Second thing, like we discussed earlier, us indulging in processed foods is the second problem. So in diabetes, whenever the symptoms start coming, so the first thing that happens many times, and I'm talking not about the type 1, okay, which happens in the early age, but I'm talking more, the most common one is the type 2 diabetes, which is the adult onset, and it is mostly diet and lifestyle related, and it can be completely reversed with diet, lifestyle, and a natural medicine approach. So there is a tripod of diabetes. You have to have proper diet, you have to have proper physical activity, and then you have to have the proper balanced natural treatment or medicine. So as soon as the person starts gaining weight, as soon as they find out their metabolism is slowing down, as soon as they find out, okay, that they feel heavy after meals, or many times in the advanced second, they will have to wake up frequently at night to urinate. And then, of course, in the lab test, it will show that your fasting blood sugar is higher, and then your hemoglobin A1C is higher. So once your doctor warns you that you are pre-diabetic, or if you have had family health history of diabetes in the family, you better start working on improving your metabolism. And so for that, physical activity every single day is important. It is a misguidance that we receive from exercise people, that working out or doing exercise 3 or 4 times a week is sufficient. That is absolutely not scientific. What I tell my patients is that if you eat every day, you have to poop every day, you have to exercise every day, you have to sleep every day. You cannot say, I'm going to eat only 4 days a week, exercise only 3 days a week, poop only twice a week, and then sleep only 5 days a week. No, these are essential. So you have to exercise every single day. And now it doesn't mean that you have to have a membership at one of the chic clubs, okay, and then or buy very expensive equipment. It can be simple thing like going for a brisk walk every day for about at least 45 minutes. Or if you don't have access to pollution-free walking areas, then you can even do some warm-up exercises. You can do Surya Namaskara at home. You can do various types of aerobic activities at home itself. But doing about anywhere between 30 to 45 minutes of physical activity, specifically in the morning before your first meal, is very important. And second thing is that to make sure that you are not having too much of laghu ahara, which is light, easy to digest foods. You should have more dhana ahara, which is what is called as complex carbohydrates. So using multi-grain or using whole grain in your food, and then using variety of lentils and pulses. That's important. And then once again, vegetables and fruits, nuts and seeds. So jala, ragi, these are more ghana, and so they go through your digestive system very gradually and don't suddenly increase your blood sugar level. Same way, variety of vegetables will provide the whole digestion in a very gradual way, and you will not have a spike. And then including all kinds of millets is very important. And then nuts and seeds are important, because nuts and seeds give you all of the healthy oils and the necessary proteins. And then finally, using the right amount of culinary herbs or spices. For example, turmeric is very important in preventing and reversing diabetes. Methi, or what we call as the fenugreek, is another important one. Also is cinnamon, and then ginger or shunti. Then you using enough of the digestive herbs like jirge or fennel seeds, cumin. That's also using them in proper amount is important. And then spacing your meals. So people who keep having snacks in between meals is an invitation for diabetes. Nowadays, along with sugar, corn syrup has become very dangerous. So earlier they used to use just cane sugar. Corn syrup now in this country has become very um, profiteering tools, because it is least expensive. Corn grows in plenty in this country, and they now use corn syrup in sodas, in juices, in various bakery products, in various sweets, and all of that. So staying away from processed sugar is very very important, because that throws off your metabolism. So if you keep proper exercise and watch your diet, and then finally comes the medicine. So in Ayurveda, there are clinically proven herbal medicines. We all know Karela or Hagalkai. So
ಆಗಲ್ಲ.
so that has a very specific effect on the whole pancreas and the liver. Then jamun, the purple berries, um, uh, that has a specific effect on your digestion. Then finally, fenugreek or methi is a spice along with cinnamon that reverses. These are some things that we know, but in Ayurveda there are even more clinically proven herbal formulas. There is one called as Madhunashini or Gymnema sylvestre. A lot of research has been done, and these formulas are in fact promoted by the Ayush department in India for reversing diabetes. So if you follow this proper triad of proper diet, exercise, and the right medicine, people don't need insulin, people don't need to take metformin, people don't need to go through all of the aggressive treatment, and then don't have to suffer through the side effects that happen.
ವಾವ್. ಸುಧೀರ್ ಗುಂಡಣ್ಣ ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಐ ಮೀನ್ ಲೈವ್ ಶೋ ಅಲ್ವಾ, ನಮ್ದು ಕಮೆಂಟ್ಸ್ ಬರ್ತಾ ಇದೆ ಎಷ್ಟೊಂದು. ಅದ್ರಲ್ಲಿ ಸುಧೀರ್ ಗುಂಡಣ್ಣ ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಪ್ರೋಗ್ರಾಮ್ ಚೆನ್ನಾಗಿ ಬರ್ತಾ ಇದೆ, ಗುಡ್ ಟು ನೋ ಅಬೌಟ್ ಡಾಕ್ಟರ್ ವಿವೇಕ್ ಅಂಡ್ ಆಯುರ್ವೇದ ಅಂಡ್ ನ್ಯಾಚುರಲ್ ಮೆಡಿಸಿನ್ ಕ್ಲಿನಿಕ್. ಸೊ ನೀವು ಹೇಳ್ತಾರ ಇನ್ಫಾರ್ಮೇಶನ್ ಎಲ್ಲ ಇಟ್ಸ್ ವೆರಿ ಯೂಸ್ಫುಲ್ ನಮ್ಮ ಕೇಳಿಗರಿಗೆ. ಈ ಹೆಲ್ತ್ ಸೀರೀಸ್ ಅಲ್ಲಿ ಅದೇ ನಮ್ದು ಧ್ಯೇಯ. ನೀವು ಕೊಡ್ತಾ ಇರೋಂತಹ ಟಿಪ್ಸು ನಮ್ಮ ಪ್ರೇಕ್ಷಕರಿಗೆ ಅವರ ಡೈಲಿ ಹೆಲ್ತ್ ಇಂಪ್ರೂವ್ ಮಾಡ್ಕೊಳ್ಳೋಕ್ಕೆ ಬಹಳ ಉಪಯೋಗ ಆಗುತ್ತೆ. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ listing all of those very useful spices, diet mechanisms, and the tripod. I think that ನಾನು ನೆನ್ಪಿಟ್ಕೊಳ್ತೀನಿ. I'm definitely guilty of eating snacks in between meals, so I'll stop that for sure.
Thank you, Sudhir avare.
So Dr. Padma avare, what are your thoughts on lifestyle changes for diabetes management? I mean, I have so many questions for you, so maybe you can just give me a quick 1 minute here.
Sure. So yeah, as Dr. Vivek was saying, diabetes ಅನ್ನೋದು ಇನ್ಫ್ಯಾಕ್ಟ್ ಬಿಫೋರ್ ಡಯಾಬಿಟಿಸ್, ಪ್ರೀ ಡಯಾಬಿಟಿಸ್ ಅಲ್ಲೇ ಸುಮಾರು ಜನಕ್ಕೆ ಗೊತ್ತಿರುವುದೇ ಇರಲ್ಲ ಡಯಾಬಿಟಿಸ್ ಇದೆ ಅಂತ ಹೇಳ್ಕೊಂಡು. ಅದೇ ಒಂದು 10 ವರ್ಷವರೆಗೆ ಇರುತ್ತೆ ಪ್ರೀ ಡಯಾಬಿಟಿಸ್, ಆನ್ ಓನ್ಲಿ ದೆನ್ ಇಟ್ ಕನ್ವರ್ಟ್ಸ್ ಟು ಡಯಾಬಿಟಿಸ್. ಸೊ ಐ ವುಡ್ ಜಸ್ಟ್ ಲೈಕ್ ಟು ಆಡ್ ಒನ್ ಥಿಂಗ್ ಇಸ್ ದಟ್ ಆ ಪ್ರೀ ಡಯಾಬಿಟಿಸ್ ಟೈಮಲ್ಲಿ ಬೇಸಿಕಲಿ ಏನಂದ್ರೆ ಒಬಿಸಿಟಿ ಇಸ್ ಒನ್ ಆಫ್ ದ ಮೇನ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಫಾರ್ ಡಯಾಬಿಟಿಸ್. ಅಂಡ್ ಯಾಕಂದ್ರೆ ಅದು ಬೇಸಿಕಲಿ ಒಬೆಸಿಟಿಯಲ್ಲಿ ಹೆಚ್ಚು ಫ್ಯಾಟ್ ಇದ್ದ ಕಾರಣ ದೇರ್ ಇಸ್ ಆಲ್ವೇಸ್ ಒಂಥರ ಕ್ರಾನಿಕ್ ಇನ್ಫ್ಲಮೇಷನ್ ಅಂತ ಬಾಡಿಯಲ್ಲಿ ಯಾವಾಗ್ಲೂ ಒಂದು ಇನ್ಫ್ಲಮೇಟರಿ ಮೋಡ್ ಅಲ್ಲಿ ಇರ್ತವೆ. ದ್ಯಾಟ್ ಅಪಾರ್ಟ್ ಫ್ರಮ್ ಒಬೆಸಿಟಿ ಅಗೇನ್ ಸ್ಟ್ರೆಸ್ ಆಲ್ಸೋ ಕಾಸಸ್ ದಟ್ ಕ್ರಾನಿಕ್ ಇನ್ಫ್ಲಮೇಷನ್ ಮೋಡ್ ಅಂತ ಇರುತ್ತೆ. ಸೊ ಆ ಪ್ರೀ ಡಯಾಬಿಟಿಸ್ ಟೈಮಲ್ಲಿ ಏನಂದ್ರೆ ಬಾಡಿ ಇಸ್ ಫೈಟಿಂಗ್ ಲಿಟ್ರಲಿ, ಇನ್ಸುಲಿನ್ ಜಾಸ್ತಿ ಪ್ರೊಡ್ಯೂಸ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಯಾಕಂದ್ರೆ ದ ಸಮಥಿಂಗ್ ಕಾಲ್ಡ್ ಇನ್ಸುಲಿನ್ ರೆಸಿಸ್ಟೆನ್ಸ್ ಅಂತ ನಮ್ಮ ಬಾಡಿಯಲ್ಲಿ. ಈಗ ಇನ್ಸುಲಿನ್ ಇಸ್ ಲೈಕ್ ಅ ಕ್ಯಾರಿಯರ್, ಅದು ನಮ್ ಗ್ಲೂಕೋಸ್ ಅನ್ನ ಬ್ಲಡ್ ಇಂದ ತಗೊಂಡು ಸೆಲ್ಗೆ ತಗೊಂಡೋಗಿ ಒಳಗೆ ಸೆಲ್ ಒಳಗೆ ಹಾಕತ್ತೆ, ಸೊ ದಟ್ ಸೆಲ್ ಆ ಗ್ಲೂಕೋಸ್ ಅನ್ನ ಯುಟಿಲೈಸ್ ಮಾಡಿ ಎನರ್ಜಿ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಬೋದು ಅಂತ. ದಟ್ಸ್ ವೈ ಈಗ ಶುಗರ್ ಇರುವಾಗ ಸುಮಾರು ಜನಕ್ಕೆ ನಮ್ಗೆ ಸುಸ್ತಾಗತ್ತೆ. ದಟ್ಸ್ ಒನ್ ಆಫ್ ದ ಮೇನ್ ಸಿಂಪ್ಟಮ್ಸ್. ಯಾಕೆ ಸುಸ್ತಾಗ್ತಾ ಇದೆ ಅಂದ್ರೆ ಅವ್ರದ್ದು ತಿನ್ನೋದೆಲ್ಲ ಶುಗರ್ ಎಲ್ಲ ಅಲ್ಲಿ ಬ್ಲಡ್ ಅಲ್ಲೇ ಕೂತಿದೆ, ಬ್ಲಡ್ ಇಂದ ಒಳಗೆ ಸೆಲ್ಲಿಗೆ ಹೋಗ್ತಾ ಇಲ್ಲ ಎನರ್ಜಿ ಪ್ರೊಡ್ಯೂಸ್ ಆಗಕ್ಕೆ. ಬಟ್ ಇನಿಷಿಯಲಿ ಏನಂದ್ರೆ ಇದು ಸೊ ಆಸ್ ಸೂನ್ as ನಾವು ಊಟ ಮಾಡಿದ್ಕೊಳ್ಳೆ ಅದು ಡೈಜೆಸ್ಟ್ ಆದ್ಕೊಳ್ಳೆ ಶುಗರ್ ಬ್ಲಡ್ಗೆ ಬಂದ್ಕೊಳ್ಳೆ ಇಮಿಡಿಯೇಟ್ಲಿ ಇನ್ಸುಲಿನ್ ರಿಲೀಸ್ ಆಗತ್ತೆ, ಇನ್ಸುಲಿನ್ ತಗೊಂಡೋಗಿ ಒಳಗೆ ಹಾಕತ್ತೆ. ಬಟ್ ಬಿಕಾಸ್ ಆಫ್ ಒಬೆಸಿಟಿ, ಬಿಕಾಸ್ ಆಫ್ ದಟ್ ಕ್ರಾನಿಕ್ ಇನ್ಫ್ಲಮೇಷನ್, ಒಂಥರ ಒಂದು ಪರ್ದೆ ತರ, ಒಂದು ಸ್ಕ್ರೀನ್ ತರ ಸೆಲ್ಲಿಗೆ ಮುಚ್ಕೊಂಡಂಗೆ ಆಗೋಗಿರುತ್ತೆ. ಅವುಗಳ ಸೆಲ್ ರಿಸೆಪ್ಟರ್ಸ್ ಎಲ್ಲ ಒಂಥರ ಎಲ್ಲಿಗೆ ಹೋಗಿ ಗ್ಲುಕೋಸ್ ಕೂತ್ಕೊಳ್ಳುತ್ತೋ ಅಲ್ಲಿ ಇನ್ಸುಲಿನ್ ಕೂತ್ಕೊಳ್ಳುತ್ತೋ ಅಲ್ಲೆಲ್ಲ ಒಂಥರ ಪರ್ದೆ ತರ ಆಗಿರುತ್ತೆ. ಸೊ ರೆಸಿಸ್ಟೆನ್ಸ್, ಸೊ ಆವಾಗ ಇನ್ಸುಲಿನ್ ಎಷ್ಟು ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ರು ಆ ಗ್ಲೂಕೋಸ್ ಅನ್ನ ಸೆಲ್ ಒಳಗೆ ತಗೊಂಡೋಗಕ್ ಆಗ್ತಾ ಇಲ್ಲ. ಅಂಡ್ ಬಿಕಾಸ್ ಶುಗರ್ ಇನ್ನೂ ಬ್ಲಡ್ ಅಲ್ಲಿ ಇದ್ದ ಕಾರಣ ಪ್ಯಾಂಕ್ರಿಯಾಸ್ ಅನ್ಕೊಳ್ತಾ ಇದ್ದಾರೆ ಇನ್ನೂ ಗ್ಲೂಕೋಸ್ ಇದೆ ಬ್ಲಡ್ ಅಲ್ಲಿ, ಏನ್ ಮಾಡೋದು, ಸರಿ ಇನ್ನೂ ಸ್ವಲ್ಪ ಎಕ್ಸ್ಟ್ರಾ ನಾನು ಇನ್ಸುಲಿನ್ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ತೇನೆ, ಇನ್ನೂ ಎಕ್ಸ್ಟ್ರಾ ಮಾಡ್ತೇನೆ. ಸೊ ಇನ್ಸ್ಟೆಡ್ ಆಫ್ 2 insulin molecules there are 6 insulin molecules, for example, to transport 1 molecule of glucose into the cell. ಸೊ ಹಾಗೆ ಹೆಚ್ಚು ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ತಾ ಇರುತ್ತೆ ಪ್ಯಾಂಕ್ರಿಯಾಸ್. ಅದಕ್ಕೆ ದ ಫಸ್ಟ್ ಟೆಸ್ಟ್ ಏನಂದ್ರೆ ಪ್ರೀ ಡಯಾಬಿಟಿಕ್ ಇರುವಾಗ ಜನರು ಇನ್ಸುಲಿನ್ ಅವ್ರದ್ದು ವೆನ್ ದೇ ಟೆಸ್ಟ್ ಫಾರ್ ಬ್ಲಡ್ ಇನ್ಸುಲಿನ್ ಲೆವೆಲ್ಸ್ ಹೈ ಆಗಿರುತ್ತೆ. ಸೊ ಇನ್ಸುಲಿನ್ ಲೆವೆಲ್ಸ್ ಹೈ ಇರುತ್ತೆ, ಬ್ಲಡ್ ಶುಗರ್ ಇನ್ನೂ ಕಂಟ್ರೋಲ್ ಅಲ್ಲೇ ಇರುತ್ತೆ. ಸೊ ಎಲ್ರು ಏನ್ ಅನ್ಕೊಳ್ತಾರೆ ಅಂದ್ರೆ ಎವ್ರಿ ಇಯರ್ ಹೋಗ್ತಾರೆ ಟೆಸ್ಟ್ ಮಾಡ್ಕೊಳ್ತಾರೆ, ನನ್ ಬ್ಲಡ್ ಶುಗರ್ ನಾರ್ಮಲ್ ಅಲ್ಲೇ ಇದೆ, HbA1c ನಾರ್ಮಲ್ ಇದೆ, ಪರವಾಗಿಲ್ಲಪ್ಪ ನನ್ಗಿನ್ನೂ ಏನು ಶುಗರ್ ಇಲ್ಲ, ಡಯಾಬಿಟಿಸ್ ಏನು ಇಲ್ಲ ನನಗೆ ಅಂತ. ಬಟ್ ಆ ಪ್ರೀ ಡಯಾಬಿಟಿಕ್ ಮೋಡಲ್ಲಿ ಆಲ್ಮೋಸ್ಟ್ 10 ವರ್ಷವರೆಗೆ ಆ ಇದರಲ್ಲಿ ಇರ್ಬೋದು. Because that insulin, pancreas is producing more insulin. So how do we get rid of that ಅಂತ ಹೇಳಿ? So a fatty layer which is being formed because of all that, ಅದನ್ನ ನಾವು ಆದಷ್ಟು instead of, as Dr. Vivek was saying, medicines ಕೊಟ್ಟು ಹೆಚ್ಚು ಇನ್ನೂ ಪ್ಯಾಂಕ್ರಿಯಾಸ್ ಅನ್ನು ಇನ್ನೂ ಇನ್ಸುಲಿನ್ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡು ಅಂತ ಹೇಳೋ ಬದಲಿಗೆ, ಇಲ್ಲ ಎಕ್ಸ್ಟರ್ನಲ್ ಇನ್ಸುಲಿನ್ ಕೊಡೋ ಬದಲು ಲೆಟ್ಸ್ ಫಿಕ್ಸ್ ದ ರೂಟ್ ಆಫ್ ದ ಪ್ರಾಬ್ಲಮ್ ಏನು, ಆ ಆ ಪರೇನ ತೆಗಿಸ್ಬೋದು. ಸೊ ಹೌ ಡು ವಿ ಡೂ ದ್ಯಾಟ್? ಲೈಕ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿಫಿಕೇಶನ್ಸ್ ಅಲ್ಲಿ ಒಂದೇನೋ ಡಯಟ್, ಹೆಚ್ಚು ಫೈಬರ್ ತಿಂದ ಕಾರಣ ಯು ಕ್ಯಾನ್ ಹ್ಯಾವ್ ದಟ್. ಅವ್ರು ಹೇಳ್ದಂಗೆ ಡೈಜೆಷನ್ ಮೆಲ್ಲ ಆಗತ್ತೆ, ಸ್ಲೋ ಆಗತ್ತೆ. ಆವಾಗ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಆ ಸ್ಪೈಕ್ ಇರಲ್ಲ. ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಒಂದು ಕೋಕ್ ಕುಡ್ದ ಕೂಡಲೇ ನಿಮ್ಗೆ ಇಮಿಡಿಯೇಟ್ ಸ್ಪೈಕ್ ಇರುತ್ತೆ ಬ್ಲಡ್ ಶುಗರ್ ಇದು. ಬಟ್ ನೀವು ಅದರ ಬದಲಿಗೆ ಸ್ಯಾಲೆಡ್ ತಿಂದು, ಫೈಬರ್ ಇದ್ದ ಕಾರಣ, ಸ್ಯಾಲೆಡ್ ಆರ್ ಓಟ್ಸ್ ಅಲ್ಲಿ ಫೈಬರ್ ಇದ್ದ ಕಾರಣ ಮೆಲ್ಲ ಡೈಜೆಸ್ಟ್ ಆಗುತ್ತೆ. ಅದು ಸ್ಲೋ ಆಗಿ ಡೈಜೆಸ್ಟ್ ಆಗುವಾಗ ಮೆಲ್ಲನೆ ಇನ್ಸುಲಿನ್ ಪ್ರೊಡ್ಯೂಸ್ ಆಗುತ್ತೆ. ಆ ಸ್ಪೈಕ್ಸ್ ಇರಲ್ಲ, ಆ ಗ್ಲೂಕೋಸ್ ಸ್ಪೈಕ್ಸ್ ಇರಲ್ಲ. ಸೊ ಇನ್ಸುಲಿನ್ ಹೆಚ್ಚು ಬೇಕಾಗಿಲ್ಲ. ಸೊ ಯು ಆರ್ ಟ್ರೈಂಗ್ ಟು ರೆಡ್ಯೂಸ್ ದಟ್. ಈ ಸೈಡ್ ಇಂದ ನಿಮ್ದು ಆ ಫ್ಯಾಟಿ ಲೇಯರ್ ಅನ್ನು ನೀವು ತೆಗಿಬೇಕಂದ್ರೆ ಅನದರ್ ವೇ ಇಸ್ ಎಕ್ಸಸೈಸ್, ಎಸ್ಪೆಷಲಿ ಲಾರ್ಜ್. ನಾವು ಹೇಳೋದು ಈಗ ಶುಗರ್ ಡಯಾಬಿಟಿಕ್ ಇದ್ದವರಿಗೆ ಊಟ ಮಾಡಿದ್ಮೇಲೆ ಒಂದು 15 ನಿಮಿಷ, ಅರ್ಧ ಗಂಟೆ, ಯು ಶುಡ್ ನೆವರ್ ಸಿಟ್ ಡೌನ್. ಊಟ ಮಾಡಿದ ಕೂಡಲೇ ಅಟ್ಲೀಸ್ಟ್ ಸ್ವಲ್ಪ ವಾಕ್ ಹೋಗ್ಬೇಕು. ಸ್ವಲ್ಪ ಎಸ್ಪೆಷಲಿ ಸ್ಟೆಪ್ಸ್ ಹತ್ತಿದ್ರೆ ನೀವು, ಬಿಕಾಸ್ ಯು ಆರ್ ಯೂಸಿಂಗ್ ಥೈ ಮಸಲ್ಸ್ ವಿಚ್ ಆರ್ ಬಿಗ್ ಮಸಲ್ಸ್ ಆರ್ ಲೈಕ್ ಗಜ್ಲರ್ಸ್. ಒಂಥರ ಸ್ಪಾಂಜ್ ತರ ಶುಗರ್ ಅನ್ನ ಬ್ಲಡ್ ಇಂದ ಎಳ್ಕೊಂಡ್ಬಿಡತ್ತದು. ಸೊ when you're using your thigh muscles to climb up, ಆವಾಗ ಅದು ಹೆಚ್ಚು ಶುಗರ್ ಅನ್ನೆಲ್ಲ ಬ್ಲಡ್ ಇಂದ ತಗೊಂಡ್ಬಿಡುತ್ತೆ. ಸೊ ನಿಮ್ pancreas can rest a little bit. It doesn't have to produce so much insulin because glucose will easily get into the muscle, and so that's not needed. So that's one of the tips kind of, or ಒಂದು ಇದು to get your sugars to lower levels.
Under control, yeah. I was again in the same stats I was seeing like close to 100 million people in this country are pre-diabetic. So ನೀವು ಹೇಳಿದ್ದಲ್ಲ, it's very useful. I think like that's why it makes me very happy to be part of this health series. ಯಾಕಂದ್ರೆ ನಾವು again all of these tips ನೀವು ಕೊಡ್ತಾ ಇರೋದು, it's so actionable. I wrote down a few things in my mind which I'll go and start today as well. So now we're all in the US, and especially Dr. Shanbhag, he's here in the valley, in Silicon Valley, and also in Dr. Padma Rammoorthy. Probably it's a thing, but Silicon Valley, it's pretty hot now, and hot meaning like lifestyle changes like body hacking or biohealth. Biohacking is a very popular thing in the valley. So ನೀವು ನೋಡಿರೋ ಪ್ರಕಾರ, there's a guy called Brian Johnson, for example. Our heart age he has reduced his heart age by like 18 or 20 years through supplements, training. He's published something called as a blueprint. I mean, Silicon Valley people do all kinds of different diets. They get on intermittent fasting. They do all kinds of things, and in general people are thinking that in this generation of people, at least Gen Z or millennials, most of them will make it all the way to 150 years. Everybody is, at least they're saying, unless there's some terminal illness, they'll make it to 150. That's the general Silicon Valley biohacking, body hacking trend. So Dr. Shanbhag, what do you think about that? And from Ayurvedic point of view, longevity, how can we increase our lifetime?
First of all, getting into something that is hype, or that is something innovative, is human tendency. We are interested in some always novelties. But when it comes to health, suddenly in last 20 years, our whole biochemistry has not changed fundamentally. So going back to regular common sense is the best thing, because the more you try to get into a hyped up special sense, you start losing common sense. So I many times say is that instead of trying to use artificial intelligence, let's try to stop natural stupidity. And so so getting rid of the natural stupidity is important. So if you want to live your full lifespan, go with the rhythm of the nature. For example, the and everything in nature has been running in rhythm. So suddenly in last 20 years, the sun has not started setting at 3 o'clock and rising at 11 o'clock. So those things are not going to be happening. So the guidelines are there is that if you have your last meal of the day around sunset, then next day only after you have done your morning routines is when you should have your next meal. So that automatically gives you somewhere around 12 to 14 hours of gap between your previous day's last meal and then today's first meal. So that is important to give your metabolism that rest. So in the morning, what I usually suggest for people is to have a glass of body temperature water, and then of course you're finishing your bathroom chores. And then first thing you have to do in the morning is do some physical activity. It could be going for a brisk walk, it could be bicycling, it could be going for a swim, or it could be doing Surya Namaskara. And then there is so much of written about Surya Namaskara and so much of research done how it is a complete um, musculoskeletal, neurological, respiratory, as well as an immune exercise. And it exercises, like Dr. Padma said, all of your big muscles, and it even works on your internal organs. So I am a big proponent of doing at least 12 Surya Namaskars every morning. And doing other aerobic activities. Of course, if you have a treadmill, if you have a elliptical, if you have access to rowing machine, any of those activities are fine. The guideline is you should have a little bit of sweat on your forehead and on your nose. So that tells you that your body is helping the proper circulation, the proper utilization of glucose is burning down the fat. So drinking warm water, then doing exercise for about at least 45 minutes. And then after the exercise, wait for at least 15 minutes before you have your meal. And then in the morning, the meal again should be not any fast food or not any processed food. So if you have a small breakfast in the morning, then you have already started your day properly. Another thing I suggest for all of us who are more into brain and mental activity is to calm your mind by doing some simple relaxation exercise. It could be Anulom Vilom Pranayam, which helps your respiratory system, which calms down your overstimulated nervous system and takes you from the sympathetic nervous system to the parasympathetic relaxation mode. That's important. Otherwise, if you start your day in a very overwhelmed, in an hyper mode, you then start making wrong choices throughout the day. So if you reset your mind properly in the morning, then your choices of food, your choices of word, your choices of decisions, your actions, all of them come okay, much more balanced, and you can stay away from that. So people have either they do their morning pujas, or people do their morning prayer, or some people do their singing practice, whatever that helps you in calming down. Many times I find that just taking a walk somewhere in natural setting, not where there is too much of traffic, but taking a walk in natural setting itself combines many of these things. So while you are doing a walk, and if you are not um, uh, engaged in any phone conversation, and if you just focus on your breathing while walking, you are doing both your exercise as well as a mind calming activity at the same time. Um, and then once you plan in the morning uh, how your day is going to be, what are your priorities, then your day is good. So I believe that those 60 to 90 minutes of morning, how you plan your activities, how you plan your calming of the mind, and how you plan your rest of the day allows your day to be healthy. and then it allows every day and every week and every month and every year to be healthy. So morning routine is what people need to stick to. And your morning routine starts the previous night. So if you go previous night to bed at 1 o'clock, you have already messed up your next day. So the previous night, plan on going to bed at a reasonable time. Maybe for some people it's 9:30. For some people it might be as late as 10:30. Then I would say not later than 10:30, because you then don't allow yourself to get enough of sleep, and then your next morning is messed up, and then your next whole day is messed up. So I give a huge emphasis on having the right bedtime, and then having the right morning routine.
ಅಂದ್ರೆ ನಿಮ್ಮಿಬ್ಬರ ಜ್ಞಾನ ಭಂಡಾರ ಎಷ್ಟು ಅಪಾರವಾಗಿದೆ ಅಂದ್ರೆ ನೀವು ಹೇಳ್ತಾ ಇರೋದನ್ನೆಲ್ಲ ಕೇಳ್ತಾ ಇದ್ರೆ ಇಲ್ಲಿ we're already run out of time, and I feel so sad. Can we
Sorry, I
have
would just like to add one
No,
one
actually, that's
thing.
what I want to follow up with you. Nimge, we've decided to run over so that we can hear your thoughts on this. Padma, what are your thoughts? Like, I'm really, this is the first time I'm feeling, oh my God, I needed a 2 hour show here.
No, I just wanted to add, I don't want to repeat what Dr. Vivek said all about it. But one thing I wanted to add is that even in lifestyle medicine, which is like so much close to Ayurveda, we call it the 6 pillars of lifestyle medicine and health. And of course, diet, exercise, and sleep, and stress, and so social connectedness. So that is one thing I wanted to add, that ಎಸ್ಪೆಷಲಿ ಈ ಕಂಟ್ರಿಲಿ ಎಲ್ಲರೂ ನಾವು ಬಂದಿದ್ದೇವೆ, ಎಲ್ಲರೂ ಇಂಡಿಯಾಕ್ಕೆ ಹೋಲಿಸ್ಕೊಂಡ್ರೆ ನಮ್ಗೆ ಇಂಡಿಯಾದಲ್ಲಿ ಎಲ್ಲಿ ನೋಡಿದ್ರು ಜನರು ಕಾಣ್ತಾರೆ, ದಟ್ ಸೋಷಿಯಲ್ ಐಸೋಲೇಷನ್ ಅನ್ನೋದು ಇಲ್ವೇ ಇರಲ್ಲ. ಬಟ್ ಇಲ್ಲಿ ನಾವು ಈ ದೇಶದಲ್ಲಿ we all have nuclear families, namdu we are so busy work and back home and money. So in these, especially in this country, I think being socially connected, elrottige, whether it's neighbors, your community, or with this with the uh, with people here, being connected is so important, because that really helps you in calming yourself. And as Dr. Vivek was saying, that parasympathetic stimulation, ಹಾಡೋದು ಸಹ, ದೇ ಸೇ ವೇಗಸ್ ನರ್ವ್, ನಾವು ಇಲ್ಲಿ ಓಂಕಾರ ಮಾಡ್ತೇವೆ ಬೆಳಗ್ಗೆ, ಮಾಡುವಾಗ ದಟ್ ವೇಗಸ್ ನರ್ವ್ ಗೆಟ್ ಸ್ಟಿಮ್ಯುಲೇಟೆಡ್. ಸೊ ದಟ್ಸ್ ದ ಸೇಮ್ ನರ್ವ್ ವಿಚ್ ಇಸ್ ಅ ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ವಿಚ್ ಗೆಟ್ಸ್ ಕನೆಕ್ಟೆಡ್ ನಿಮ್ಮ ಗಟ್ಟಿಂದ ಬ್ರೈನಿಗೆ. ಸೊ ಒಳ್ಳೆ ಊಟ ಮಾಡಿದಾಗ ನಿಮ್ಗೆ ಎಷ್ಟು ಖುಷಿ ಆಗತ್ತೆ, ಅದು ಯಾಕೆ? ಬಿಕಾಸ್ ಆಫ್ ದಟ್ ನರ್ವ್, that serotonin which is released, and that connection between the gut and the brain. Similarly, ಹಾಡಿದಾಗ, ನಿಮ್ಗೆ ಒಳ್ಳೆ ಹಾಬೀಸ್ ಇದ್ದಾಗ, ಹೊರಗೆ ಹೋದಾಗ, everything is trying to stimulate that parasympathetic system. Sympathetic system is the stress system. Stress iruvaga your digestion comes down. Stress iruvaga, ಅದಕ್ಕೆ ನೀವು ಊಟ ಮಾಡುವಾಗ ಹೇಳ್ತಾರಲ್ಲ, ಕಾಮ್ ಆಗಿ ಊಟ, ಕಾಮ್ ಆಗಿರ್ಬೇಕು ಅಟ್ಮಾಸ್ಫಿಯರ್ ಎಲ್ಲ. ಏನೋ ಟಿವಿಯಲ್ಲಿ ಏನೋ ನೋಡ್ಕೊಂಡು ತಿಂತಾ ಇರುವಾಗ ಅಲ್ಲಿ ಏನಾದ್ರೂ ವೈಲೆನ್ಸ್ ಬಗ್ಗೆ ತೋರಿಸ್ತಾ ಇದ್ರೆ, ಯು ಆರ್ ಲೈಕ್ ವರ್ಕ್ಡ್ ಅಪ್. ಸೊ ನೀವು ಊಟ ಮಾಡೋದು ಏನು ಸರಿಯಾಗಿ ಡೈಜೆಸ್ಟ್ ಆಗಲ್ಲ. ಯೋ microbiome is also probably thinking, oh my God, ಏನಾಗ್ತಾ ಇದೆ ಅಂತ ಹೇಳ್ಕೊಂಡು. ಸೊ ಇಟ್ಸ್ ಆಲ್ಸೋ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ದಟ್ಸ್ ದ ಫಿಫ್ತ್ ಇಸ್ ದಟ್ ಸೋಷಿಯಲ್ ಕನೆಕ್ಷನ್ಸ್ ಅಂತ ಹೇಳ್ತೇವೆ. I want to really stress on that social connections too. And the sixth one is, of course, addictions. As much as possible, I know we all need our coffees, our teas, and some people also, alcohol, but everything in moderation is the most important thing, I guess. I'm not saying you need to stop everything tomorrow. And even in our lifestyle program that we do online, now they ಹೇಳ್ತೇವೆ, for everyone who join us, we don't immediately say from tomorrow you're going to stop everything and do this diet and do that diet. That's not going to be sustainable. So we go through it in a 12-week in a phased manner, and I think that's most important. I don't want to take a whole lot of time. I think we're running out of time. I understand.
It's okay.
Deore, you had talked about biohacks. I want to quickly mention that one of the biohacks is specifically after age 50 or so for people is to reset their metabolism, because we have spent so much of our working years, okay, in overworking, getting stressed, taking care of our children, home, finances, this, that, and other. But around that age, okay, when the women start having the menopause, and then men also start feeling that fatigue, both physical and mental fatigue. Ayurveda specifically, it doesn't call it a biohack, but it says, hey, do something to slow down the aging. And for the anti-aging, there is a whole process of resetting your metabolism, a whole rejuvenative process called as panchakarma, which is completely natural. So there is no use of chemicals. There are no surgeries that you go through, but you go through a whole process for about 5 days or so, okay, where as per your body's metabolism, food is cooked by the nutritionist, and then there are certain treatments done to rejuvenate all layers of your tissues, and it's called as a rasayana. Means there are, Ayurveda talks about 7 tissues, starting from rasa, rakta, mausa, meda, asti, majja, shukra. So for all of those tissues to be rejuvenated and to reset your metabolism, so it actually, that whole process resets your pituitary, your thyroid, okay, your pancreas. So people lose weight without even fasting one single day, and then they find that their skin is much more healthy, the range of motion becomes better, their blood pressure goes to normal, the blood glucose level go to normal. So when people attend some of our lectures, like in workshops on panchakarma, they get all fascinated and say, hey, this seems to be the most natural biohack, okay, where you are not buying another bunch of pills, or where you are not going through a surgery for facelift, but just by going through this very simple process for 5 days, you feel rejuvenated. And a lot of literature on panchakarma, and I'll be even happy to share that if somebody approaches our website. So we have our website yogaayurveda.org, and all of the information is there free. So it doesn't even require any cost to understand it.
Wow, that was very helpful. It looks like now several thousand years ago, we in India were the original biohackers. So Ivaga, the recent Silicon Valley is like, we can give them some hacks. So that is super helpful. Thank you so much for sharing your website as well. So Dr. Padma, what is your parting thoughts? ನಮ್ಮ global ಕನ್ನಡಿಗರಿಗೆ ನಿಮ್ಮ ಸಂದೇಶ ಏನು?
I would just say live happily. I mean, as I said, social connectedness is so important. Eat healthy, move. That's very important. And, yeah, social connectedness, and as much as possible, everything in moderation. I think that's the best thing. And no stress, calm, meditate, and sing and dance and enjoy life. Yeah.
Awesome. Dr. Shanbhag ಅವರೇ, ನಿಮ್ಮ ಸಂದೇಶ ಏನು ನಮ್ಮ global ಕನ್ನಡಿಗರಿಗೆ?
So Kannadigar Sanskriti has been a very healthy Sanskriti. So remember how you grew up, okay, in your hometown, okay, those vegetables, those fruits, okay, those outdoor activities that you did, those social activities that you did with your family when the cell phones were not there, okay, when we were not watching YouTube videos, okay, good 4 hours a day. So do all of those things, okay, go for walks, okay, get together with your family and friends, eat healthy food without sitting in front of the television, and eat the balanced food with all the vegetables, with all of the jolad roti, or whether it is ragi mudde, or all of the karu that we all enjoyed, and then get rid of sugar and go back to bella. And we all find, if you go back to our Kannada roots, and staying in touch with all of our Kannada friends and family, that itself, okay, will take you beyond 100 years. You don't need to get into all of the modern, hyped up chemical medicines or chemical foods, or other artificial stimulants.
Wow, wonderful. And this is the easiest advice I've ever heard. ನೀವು ಚೈಲ್ಡ್ಹುಡ್ ಅಲ್ಲಿ ಏನ್ ಮಾಡ್ತಿದ್ರು ಅದನ್ನ ಮಾಡಿ ಅಂತ ಹೇಳಿದ್ರು. ಸೊ ನಮ್ಮ ತಂಡದವ್ರಿಗೆಲ್ಲ ಐ ರಿಕ್ವೆಸ್ಟ್ ಯು ಟು ಟರ್ನ್ ಆನ್ ಯುವರ್ ವಿಡಿಯೋ. ಸೊ ನಮ್ಮ ಪಾರ್ಟಿಂಗ್ ಥಾಟ್ಸ್ ಹೇಳಕ್ಕೆ ಸುರೇಶ್ ಅವರು ಇದ್ದಾರೆ. ಬಟ್ ಲೈಕ್ ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ವಿವೇಕ್, ಡಾಕ್ಟರ್ ಶಾನ್ಭಾಗ್ ಅವರೇ ಮತ್ತೆ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಅವರೇ. ಇಟ್ ವಾಸ್ ಮೈ ಅಟ್ಮೋಸ್ಟ್ ಪ್ಲೆಷರ್ ಟು ಗೆಟ್ ನಾನು ಹೇಳ್ದಂಗೆ ನಿಮ್ಗೆ ಜ್ಞಾನ ಭಂಡಾರ ಎಷ್ಟು ಅಪಾರ ಅಂದ್ರೆ ಐ ಕುಡ್ ನಾಟ್ ಕವರ್ ಈವನ್ ಹಾಫ್ ಆಫ್ ದ ಕ್ವೆಶನ್ಸ್ ಐ ಹ್ಯಾಡ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ನೀವು ಟೈಮ್ ತಗೊಂಡು ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಬಂದಿದ್ದಕ್ಕೆ. ಸುರೇಶ್ ಅವರೇ, ಇಟ್ಸ್ ಆಲ್
Thank
ಯು.
you. Thank you for giving us the opportunity. ಕೊಟ್ಟದಕ್ಕೆ thank you, and I hope we were. I hope I was of help.
It was more than that. So,
ಧನ್ಯವಾದ ನಿಮ್ಗೆ.
ವಿವೇಕ್, ಮೊದಲನೇದಾಗಿ ನೀವು ನಮ್ಮ ವೇದಿಕೆ ಬಂದು ನಮ್ಮೊಟ್ಟಿಗೆ ನೀವೆಲ್ಲ ಹಂಚಿಕೊಂಡಿದ್ದಕ್ಕೆ ಮೊದಲನೇದಾಗಿ ಧನ್ಯವಾದಗಳು. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಕಮಿಂಗ್, ಟೇಕ್ ಇನ್ವಿಟೇಷನ್, ಕಮಿಂಗ್ ಟು ದ ಥಿಂಗ್. ಇದು ದೇವ್ ಹೇಳ್ದಂಗೆ ನೀವು ಜ್ಞಾನ ಭಂಡಾರ. ವಿ ಕುಡ್ I just realized that this needed maybe 4 to 5 times more time. ಇದು ಉಪನ್ಯಾಸ ಕೇಳ್ದಂಗೆ ಅವ್ರು ಅಲ್ಲಿ ವೇದ ವಾಕ್ಯ, ನಿಮ್ದು ವೈದ್ಯ ವಾಕ್ಯ, ಅದನ್ನ ಹೇಳ್ಬೋದು ನಾನು, ವೈದ್ಯ ವಾಕ್ಯ ಅಂತ. ನಿಮ್ಮ ಜ್ಞಾನ ಎಷ್ಟಿದೆ ಅಂದ್ರೆ ಎನಿ ಸಬ್ಜೆಕ್ಟ್ ಯು ಟಚ್, ಯು ಗಾಟ್ ಸೋ ಡೀಪ್ ಇನ್ ಟು ಇಟ್. ಒಂದೇ ಒಂದು ಪ್ರಶ್ನೆ, ಒಂದು ವಿಷಯ ಏನಂದ್ರೆ, ಅಲ್ಲಿ ನೀವು ಮಾತಾಡ್ತಿದ್ ಕೇಳಲಿಕ್ಕೆ ಎಂತ ಜಾಸ್ತಿ ಜ್ಞಾನ ಬೇಡ, ಬರೀ ಒಂದು ನಿಷ್ಠೆ ಬೇಕಷ್ಟೇ, ಕೇಳಿಸ್ಕೋಬೇಕಷ್ಟೇ, ರೈಟ್? ಕೇಳಿಸ್ಕೊಂಡು ಅಳವಡಿಸ್ಕೋಬೇಕು. ಇಟ್ ವಾಸ್ ಫ್ಯಾಂಟಾಸ್ಟಿಕ್ ಟಾಕಿಂಗ್ ಟು ಬೋತ್ ಆಫ್ ಯು. ನಿಮ್ಮ ವೈದ್ಯಕೀಯ ವೃತ್ತಿಯಲ್ಲಿ ನೀವು ಪಡ್ತಕ್ಕಂಥ ಜ್ಞಾನ, ನೀವು ಜನಿಗೆ ಹೇಳುವಂತ ರೀತಿ, ನೀವು ಯಾವ ರೀತಿ ಇದನ್ನ ಹೇಳ್ತಾ ಇದ್ದೀರಾ, ಹೇಗೆ ಮನದಟ್ಟ ಹೇಳ್ತೀರಾ, ತುಂಬಾ ಶ್ಲಾಘನೀಯ. ದಯವಿಟ್ಟು ಕ್ಷಮಿಸಿ, ಒಂದೇ 60 ನಿಮಿಷ ಮಾಡಿದ್ದಕ್ಕೆ ಕ್ಷಮಿಸಿ, ನಾವು ಇನ್ನೂ ಜಾಸ್ತಿ ಮಾಡ್ಬೇಕಾಗಿತ್ತು. ದೇವ್ ಹೇಳ್ದಂಗೆ ಅರ್ಧಂಬರ್ಧ ಕ್ವಶನ್ ಕೂಡ ಕೇಳಕ್ಕಾಗ್ಲಿಲ್ಲ. ಆದ್ರೂ ನಾವು ಕೇಳಿದಷ್ಟು ಮಟ್ಟಿಗೆ ಇದು ಐ ಥಿಂಕ್ ದ ರೆಕಾರ್ಡಿಂಗ್ ಆಫ್ ದಿಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಪ್ರೋಗ್ರಾಮ್ ವುಡ್ ಬಿ ದ ಮೋಸ್ಟ್ ವ್ಯಾಲ್ಯೂಬಲ್ ಅಸೆಟ್ ವಿ ಕ್ಯಾನ್ ಗಿವ್ ಬ್ಯಾಕ್ ಟು ದ ಕಮ್ಯುನಿಟಿ. ಯಾಕಂದ್ರೆ ಪ್ರತಿಯೊಂದು ನೀವು ಹೇಳಿದ ಪ್ರತಿಯೊಂದು ಥಿಂಗ್ಸ್, ಎವ್ರಿಥಿಂಗ್ ಯು ಸೆಡ್, every ವಾಕ್ಯ you said, every sentence you said was of such a great information and inspiration, right? It's just not taking it, it is ಅಳವಡಿಸ್ಕೊಳ್ಳೋದು. ಸೊ ಕೇಳಿದ್ರೆ ನೀವು ಅದನ್ನ ಕೇಳಿದ್ರಿ, ಅಳವಡಿಸ್ಕೊಳ್ಳಿ, ನಿಮಗೂ ಅದರಿಂದ ಸಹಾಯ ಖಂಡಿತ ಆಗತ್ತೆ. ನೀವೆಲ್ಲ ಕೇಳಿದ್ದೀರಾ. ಅದೇ ರೀತಿ ನಿಮಗೆ ಬೇಕಿದ್ದಲ್ಲಿ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ರಾಮಮೂರ್ತಿ ಅವರಾಗ್ಲಿ ಅಥವಾ ನಮ್ಮ ಡಾಕ್ಟರ್ ವಿವೇಕ್ ಶಾನ್ಭಾಗ್ ಆಗಲಿ, ಅವ್ರನ್ನ ಭೇಟಿ ಮಾಡೋದು, ಅವ್ರನ್ನ ಹೋಗಿ ಅವರ ಸಲಹೆ ಕೇಳೋದು ಅಥವಾ ಕನ್ಸಲ್ಟೇಷನ್ ಮಾಡೋದು ಖಂಡಿತ ಉಪಯೋಗಿಸ್ಕೊಳ್ಳಿ. ಸೊ ಖಂಡಿತ ಬಹಳ ಧನ್ಯವಾದಗಳು. ಮತ್ತೊಮ್ಮೆ ಬಹಳ ಚೆನ್ನಾಗಿತ್ತು. ನಿಮ್ಮ ಸಾಧನೆ ಅಪಾರ, ನಿಮ್ಮ ಜ್ಞಾನ ಅಪಾರ. ಬಟ್ ನೀವು ಇವತ್ತು ಬಂದು ನಮಗೆ ಹೇಳಿದಕ್ಕೆ ತುಂಬಾ ಸಂತೋಷ ಆಯ್ತು. ಜನರಿಗೆ ಬಹಳಷ್ಟು ವಿಷಯ ತಿಳಿಸ್ಕೊಟ್ಟಿದ್ದೀರಾ. ಬಿಗ್ ಥ್ಯಾಂಕ್ಸ್ ಟು ಯು.
Thank you.
They can conclude now.
So, thank you. ಮುಂದಿನ ವಾರ ನಾವು ಇದೇ ರೀತಿ ಮತ್ತೊಬ್ಬ ಸಾಧಕರೊಡನೆ ಸಂವಾದನ ನಡೆಸ್ತೇವೆ. ಅಲ್ಲಿ ತನಕ ನಿಮ್ಮ ಮನಸ್ಸಿನಲ್ಲಿ, ಹೃದಯದಲ್ಲಿ ರಾರಾಜಿಸುತ್ತಿರಲಿ ಬೆಂಗಳೂರು ವಾಯ್ಸ್. ಲಿಸನ್ ಟು ಯುವರ್ ಹಾರ್ಟ್.
ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ.
ಆಲಿಸು ಗೆಳೆಯನ ಹೃದಯದ ಮಾತೊಂದ, ಬಿಚ್ಚಿಡು ಬಚ್ಚಿಟ್ಟ ಮನದ ಕನಸೊಂದ. ಹಿಂದೆ ಸಮಯ ಮುಂದೆ ಇಡಲು ನಮ್ಮ ಹೆಜ್ಜೆಯ ನಿನ್ನ ಸಾಹಸ ರಥಕ್ಕೆ ಸಾರಥಿಯಾಗಿ ಮುನ್ನಡೆಸಿದೆ. ನಿನ್ನ ಬಾನಂಗಳ ಕೆಳೆದೊಯ್ಯುವ ರೆಕ್ಕೆಯಾಗಿ ಕೂಡಿದೆ. ಬೆಂಗಳೂರು ವಾಯ್ಸ್, ಬೆಂಗಳೂರು ವಾಯ್ಸ್.
Bengaluru Voice. Listen to your heart.